Hello, this is case study number 2 for the course SPCE 683 section A02, and my name is Rosemary Perez. First, I want to share some details about the client. He is 8 years old. He is in 2nd grade in an elementary school. His diagnosis is ADHD, attention deficit hyperactivity disorder combined type. He also has developmental articulation disorder, delayed developmental milestones, and anxious mood. The therapy services that he currently receives are ABA, speech, and occupational. The behaviors of concern of the client are non-compliance with activities of daily living. He has tantrums and wandering. And then the interventions that usually work best for him are functional communication training, DRA, redirection, and pre-mark principle. The behavioral targets for this client are tantrums and non-compliance with ADLs. For tantrum behavior, the operational definition is any distance in which the client engages in crying behavior. This is vocalizations louder than normal speaking voice, lasting longer than 3 seconds, with or without tears, flopping to the floor and refusing to stand up, screaming, vocalizations louder than normal speaking voice, lasting longer than 3 seconds and without tears, and then lastly, banging floor, using any part of the body or an object to make contact with the floor and make a loud sound. An example of this behavior target is crying and flopping to the floor when given a task demand. A non-example would be crying and flopping to the floor due to an injury and that the client is in pain. For non-compliance, the operational definition is any instance in which the client verbally and or physically refuses to complete a task demand or follow an instruction. The example could be the client refuses to complete a given task after 30 seconds have passed from the instruction. And then a non-example could be that the client engages in a response that is aligned with the delivery instruction. In this slide, I will be sharing the interventions used for this client. For the behavior of tantrum, the intervention that will be used is escape extension. And the reason is because the function of the majority of this client's behaviors is escape from demand, escape from activities, completing tasks, from parents, teachers, RBT, and therefore escape extension would be the best intervention to use for this client. And then for non-compliance behavior with ADLs, the interventions that would work best are redirection and pre-mark principle. Redirection would work really great because we are trying to shift the client's attention from the undesirable behavior towards the desirable behavior. And then pre-mark principle is because we want to have the client complete the task and we want the client to be motivated that he is going to receive a reward. Therefore, compliance is increased. And also, before I end this slide, I wanted to share that for escape extension, the client is also being prompted. We want to physically prompt the client to complete the task because with escape extension, we want the client to successfully complete task. Since he is trying to avoid or escape, we want to have the client complete task, and this is obviously going to increase task compliance, task completion, which is all very beneficial for the client. And then lastly, the intervention goals. For escape extension, it will be to reduce the frequency, intensity, duration of the challenging behavior, in this case, tantrums. Then we want to track the progress of the behavior over time to see if we need to make any adjustments to determine whether the intervention is working, all of that. We also want to improve the client compliance with tasks that the client escapes from or avoids. And we want to promote generalization and maintenance of this skill to other settings. And then for redirection, we want to reduce the intensity, duration, and frequency of the non-compliance behavior by shifting the undesirable behavior to desirable behavior. We want to increase desirable behaviors. We also want to identify the triggers that may be causing the inappropriate behaviors. We want to encourage the client to engage in the desirable behavior and the alternative behaviors over undesirable behaviors with this intervention. And then also redirection is going to help us increase the occurrence of desirable behaviors, as I kind of mentioned before. And then lastly, for pre-mark principle, which is the last intervention that I'm sharing about this client, the goal of using this intervention is to increase task compliance and completion by using preferred activities as a reward. As I mentioned before, reinforcement for this client is technology use and sensory activities. Therefore, we want to use that when implementing pre-mark principle in order to get the client to complete the desirable task or engage in the appropriate behavior. Another goal is that we want to improve the client's motivation to complete non-preferred tasks. We do this with the rewards that we're offering the client. And we want to foster a sense of independence because we are encouraging the client to complete tasks on its own and maybe tasks that are less preferred. And he is fostering independence, and that's great.